welcome to my fourth podcast since the lockdown, Entire Media Connect. This is the platform where great minds like yours come together and we dwell on principles, doctrines, and facts. And upon those deliberations, we come up with purely information, educative, and possibly solution. It is important to make it clear that I am not being paid or any of my opinions here are not influenced by any form of government official. So we'll kick off by starting with the topic. Now, I spend a lot of time watching the government policies. Initially, we were thrown into the deep end where we were suggested not to wear masks, and then consequently later on, we were suggested to wear masks. I'm going to start off with Boye, purely because, Boye, you are in a medical institution. Now, would you mind just sharing your insight into the concept of face mask and face clothing and how it works to the purpose of the general public?
Okay, I think that's very useful, actually. It's a good topic to kind of feed into. But first and foremost, let me first thank you for inviting me to this platform, because I think it's quite important to know that I've got people that I can learn from today, and to also share the opinion I have heard. And you're right, I work at the Greater Ministry Hospital, but I pledge no conflict to what I'm doing here. So I'm speaking as a public person, and I can only share my experience from my perspective as a member of the public. So the current thinking we have is that the use of masks prevents the spread of COVID-19. And we also know that from evidence that there could also be other factors that precipitate the gradual decline in the health condition of people that actually contract this disease. And we know we've heard a lot about the evidence of age, the social status, which is linked to underlying conditions, and the access to early testing. And also these are kind of seen as the early evidence or what you call indicators of morbidity and mortality as seen with people that contract this disease. Now, from testing data, we also know that there's an overwhelming case of people that actually are asymptomatic and often are the real evidence of the spread that we see around in the public. So where are we with this? So narrowing down to the issue of masks, we know that if we are not truly dealing with the mask situation, i.e. if we're not actually using the preventative measures, which includes masks, we are likely not to be able to have a feel of control of this condition. And evidence will show that the only narrative we can draw from this experience is the fact that aerosols are the media for spreading this condition. So we look at cases that are so-called asymptomatic, and we see people that are not affected. One thing that we know for a fact is creating a barrier between these two groups of people would obviously limit the spread. Now, in terms of the barriers we're talking about here, I think you should not assume that testing takes place in all places. Once you're a carrier of the infection, the likelihood is if you're wearing a mask, we can't guarantee that wearing a mask is doing anything to stop you from really getting on your condition. What it can do, however, is it can actually stop other people from contacting it. So there's something about the culture we have in this kind of situation. So we look at the culture in the China district where this actually was first, where it emerged in the Wuhan district. Now, in the Wuhan district, their way of returning the message to everyone that was willing to engage in their story and learn from the experience is that they got down to about 1 meter social distancing in the end. And that culture in itself was because they were able to use masks, they disinfected their public arena, they managed to do a lot of decontamination of the things that they were using in environments of health. And they also ensured that there was a rebuke and there was a kind of penalty for not following those things. So I think it speaks about the way we police things. And I think we'll like to hear more about that in future. But let's come back to the UK. The one thing I see in the UK, in particular with regards to masks, is the way we actually use the masks. So I'll be quick to say that when I go on the underground in the morning as early as 6 o'clock, I hear all the message on the PA system that we should always keep the masks on through the course of the journey. However, the people that actually walk on the underground themselves are not good advocates for this because they don't always wear it. So I look at that in terms of the policing of all these events. And I always worry about the fact that if we don't have a culture shift that makes us understand the way this virus works, talk about the mask in itself, and talking about it in itself in isolation will not cure, will not actually give us control over this spread. But one thing I'm less convinced about also is the fact that people that don't think about managing their contact with people in terms of social distancing, the whole idea of sneezing into tissue and things like that are all issues that we're concerned about. So what I want to kind of bring to this forum is the fact that I'm still a bit skeptical about policing the guidelines on masking.
Okay.
And I'm concerned about the fact that there's a clear indication between covering and masking. And I think what you mentioned earlier on about covering is where we can at least ensure that we cover the face as best as we can, the areas that obviously would emit aerosols, that's the mouth and the nose, and to be very mindful of the fact that to maintain masking, we need to follow the guidelines of masking, which I don't think everybody has a good hold on. So at this point, I'm going to kind of leave it with the panel, because one thing I'll say is I know I've given more questions than answers, and I remain very unapologetic about that, because I think that's why we... Thank you very much.
I thought it was important to let you get the bulk of the information out of your chest, and that's why I made sure you started off, open the dialogue. Now, I'm going to hold on to the thought of skepticism, and we'll come back to that in a minute. Let me quickly touch base with John. Now, John, it would be interesting to let us know, we've been under the lockdown for a while. Businesses are struggling. They're about to resume. And what I possibly would like to draw from your experiences, since you've more or less resumed back to work, how has it been? I know the environment where you work is extremely busy, and I know your job brings you in contact with a lot of people. Would you mind sharing your current experience? And please make it brief, because Boy has stolen quite a bit of our time.
Good afternoon to my fellow panel members, to the host, and to all those who are watching on social media. My name is John Abiona. I'm an environmental health practitioner. Just like you said, we just want to have a quick recap. This problem was traced to our laboratory of food market in Wuhan. And the problem that we now have is we know what we know, and we don't know what we don't know.
Right.
Okay. What we now know is been traced to a food laboratory or food market or lab in Wuhan, China. That one we know. But what we don't know at the onset was mass gathering, which we're all used to. It's a no-no. Mass gathering of people now, it's been known to actually accelerate the spread of COVID-19. So that's where the idea of social distancing come in order to make sure that we do not accelerate the contact of people. I'm just going to quickly talk about what we've been doing as environmental health practitioners since the lockdown. It's very difficult, especially for pubs and restaurants. We know they do help to make the economy buoyant. And from time immemorial, people have always been happy about mass gathering. You come around and celebrate. And you have people 50, 60, 70, 80, all in a very small space. Especially in pubs and restaurants, whereby they have a very small profit margin. They've been used to, for example, I'm just going to use a scenario. We'll have a pub that serves food to 50 people. They make a profit of £1,000. With the new lockdown rules and social distancing now, instead of having the capacity to serve 50 people, they can now only serve 25 because of the 2-meter rule, and now be cut down to 1 meter plus. So without going to anything astronomical, you can bet that straight away the profit margin is moved from £1,000 to £500.
Right.
So they cannot have the maximum capacity which they do have. So this is one of the problems that we have, and this is one of the things which the government is looking into. As environmental practitioners, we're also involved in track and trace, and anybody who's been involved in it will know what it's talking about. The last thing I'm going to say, because of time, I'm going to talk about the R number. We know the Scientific Advisory Group for the government, it's called the SAGE. They've been working about R number. For the benefit of our viewers that are not familiar with R number is a measure of how many people on average each infected person transmits the virus to. So it's been proven now that if you can keep the R number under 1, then you're on the winning side. But the last thing we had is that there's an increase in the range from 0.8 to 1 last week, and it's now moved on to 0.9 to 1.1. So we're not winning the war at the moment. I'm afraid we need to do more to be able to keep this under control. Thank you. I hope that's brief enough for
Right,
you there.
fantastic. All right, great. I've just been told by my administrator that we now have unlimited time, so we can actually stretch this for an hour. I mean, I thought I was perked to the first 45 minutes with Zoom, but we have an hour, so we've gone the first 16 minutes, which is fantastic. Let me quickly bring in Emmanuel. Emmanuel, I think your job is pretty straightforward, and I must comment that you're involved in a big project that was, should I say, inherited by the previous government. So you would have come in contact with government officials that were previously with the previous government and the current government, and you will have seen cross policies happening. Now, share your experience from the COVID response when you come in contact with your, should I say, your colleagues at work, and should I say with the scheme of your job title.
Thank you very much. It's really a pleasure to be on this platform. I really appreciate that. And thank you for this invitation. Yeah, looking at from the environmental aspect of the COVID-19, what it actually offered the environmentalist when it started was a wow situation when you measured the emission of greenhouse gas. And we found that a reduction, about 50% reduction, the reason being that people were in lockdown, countries were not functioning, so there were no aircraft, no vehicular movements, so everything was standstill. And people were, the world, the way we termed it was, it has a new lease of life. You know, we thought that would continue. But unfortunately, that was short-lived when lockdown started easing up and the promotion of masks started emerging. So we see people like in the first month of May, people like Italy imported about 1 billion masks. France, 2 billion pieces. And then if you do the maths, in China, in India, in United States of America, UK, you see the billions, tens of billions of masks coming in a short space of time. And what does this represent? It was this to us will see the upsurge of contamination. We see the upsurge of masks littering here and there. And it has been found in seas, in waterways, you know, even when you are walking along the street, sometimes I'll be walking along the street and I pick up and I see masks littering along on the road. Yep. You know, this, I'm not excluding the good things that mask offers. Mm-hmm. I'm not doing that. But when I'm looking at it from an environmental perspective, what the problem it's creating, because if you're looking at the two types of masks that we use, there are the ones that you use, you can reuse, reusable ones, and there are single-use masks, which, from what I've seen, is the more prominent ones that are being used, the single-use masks. Right. And don't forget that they are being made by plastic materials. You know, so we were talking about problem of plastic, and look at us within a short space of time.
That's right.
Having this amount of plastic that we are, you know, we have increased in our respective countries. And how do we dispose this? Some people, you know, it goes into the seas. It affects our aquatic animal. It affects our environment. Mm-hmm. Some people dispose this through the toilets, sadly.
Yeah.
Yes.
Okay.
And some put it in recycle bins.
Right.
So what you see, instead of recycling the bin, those in recycling industry, they take the whole thing into no longer recyclable because you have contaminated the bin. They now go into landfills. And of course, this has up to a maximum of 450 years to degrade. and that is
Wow.
plastic for you. So these are some of the problems that we have seen. We have talked about the mask, but we've not talked about the disposal. We've not talked about how we can contain the environmental impact. And that
Okay.
is where everybody is lacking at the moment.
All
I've
right.
not heard from anybody who's talked about how this can be a clear guideline on how you can dispose these materials. And that
Okay,
is what.
Emmanuel, let me stop you on the care guideline. I'm going to come back into that point, which is quite crucial, because I also quickly want to bring up, we have a lawyer in house, which is quite great. And I quickly want to bring him in. Lanre, your
Yes.
job is pretty straightforward. I just want you to briefly clarify the law concerning the individual rights and the mandatory use of wearing a face mask. I know these are new litigations that possibly, I'm not sure if there have been statutory provisions for this prior to now. So I do know this is a noble case, so perhaps you can enlighten us briefly, and then we'll throw the debate, we'll throw the conversation wide open.
Thank you very much. I'm Lanre Hastrup. I'm a lawyer, as you said. I'm grateful for your kind invitation coming here today and explaining or elaborating on the law. But to start off with, the first point is that we have in this country provisions that are fundamental. These are human rights provisions. And an individual has a right under Article 10 of that law to basically express themselves. And that includes expression, vocal expression, words, or the way you dress. So if I want to wear Levi jeans, that's up to me. If I want to wear anything, that's up to me. So wearing a mask is a form of expression. And some people may not feel comfortable in wearing a mask. So if you force people to wear a mask, invariably, what you're doing is you're breaching your Article 10 rights. That's the first point. Now, the government will turn around and say, well, we're trying to look after the public, save lives. But that will be under Article 2, which is right to life. And the government has a positive duty to save lives. And in so doing, though, they must do it within the context of proportionality. So you can't break an egg with a hammer. The force needs to be proportionate. Now, so we have on one hand, Article 10, freedom of expression, contending with Article 2, right to life. One of them is more sacred. Obviously, Article 2 is more important because that's right to life. That's the ultimate when we take that point. So, but even within Article 2, the government must still act proportionate. So what we have now is laws that have been passed that you must do this, where there are less intrusive ways of people doing it. So my point is, you can't force people in public setting to be wearing a mask when there are less intrusive ways of making them do it. Now, one of the ways you can do that is you issued guidelines. And to be fair to the government, they've issued guidelines. That's more discretionary. It's up to you if you want to follow that guidelines. Now, they've then gone ahead and said you must wear a mask in public setting, transport, galleries, museums. Now, that is the bit we have issues with. You can't force me to wear a mask and then finish it off by saying, oh, there's a £100 fine, and failure of paying that £100 fine, I will then be getting a conviction. Lord Sumption, who retired from the Supreme Court recently, has raised the roof on this issue. You are locking down the country because of COVID. You're telling people, do this, do that. So Cromwell will be turning in his grave. Civil rights people will be turning in their grave right now, saying, hold on a minute. So because of COVID, that an individual can decide whether to wear it or not. You're now turning the country into chaos. That's one. And number two, there is no duty on anyone to look after his neighbor. So if you go on the government website, it says the mask is not just for you. It's also to protect others. I'm sorry, if you leave your house and you know you're at risk of wearing a mask, it's up to you to wear that mask. It's not for me to look after you. There is no duty in law for me to look after my neighbor. So I don't have to wear a mask. That's what the law is. So my Article 10 right is being usurped by this government So I can't express myself by not wearing or wear whatever I want to wear. Number two, you're now saying you want to save lives, but there are less ways. You can issue guidelines. You're not doing that at the moment because you're giving people £100 fines and convictions. And then finally, you're now making me responsible for looking after my neighbor. The law is clear. It is illegal. Guidelines is lawful. Making people wear it is unlawful.
Thank you very much. I think now this is the part where it gets interesting. So we're going to just show it open. It's an open flow. Now, as the moderator, I have picked up I've done quite a few observations during the lockdown. I've been to places that wasn't meant to go. I've actually even had the experience of being admitted into the hospital during the lockdown just to snoop into what really goes down next to the COVID ward that was. I'll start off by my observation in a restaurant recently. I mean, obviously, I'm not going to mention the name of the restaurant, for the purpose of litigation that might come after me or anything. Now, feel free. Whoever picks up this one is happy to answer. I'll be more than happy to engage you with it. Typical restaurants, we all have to eat, which has been the case. A lot of people who have recently had to rely on Uber Eats, the food being delivered, or picking up to your local to take up a takeaway. Now, I've observed this not once, not twice, not thrice, where you have a restaurant that is offering a takeaway service where you pop into the store and you put your mask on. Now, contradiction then quickly evolves from this, because recently the government has insisted that it's time for business to open. Restaurants have now opened, and you can have I've seen a table of 4. My observation in an instant was not once, not twice, table of 4. The restaurants are happy to serve a table of 4 without a mask on. And at the same time, the same restaurant is selling to people who are here to collect the takeaway with a mask on. I'm not sure if you can see the contradiction is. Can you tell me what exactly are the thinking? I mean, is it that when you're inside a restaurant and you have a pocket of 4 people, you're immune to the transmission or no? I don't know. Anyone feel free to answer. I see John nodding his head. Perhaps you might want to take it. But that's an observation. I don't know if anyone's had the same observation.
No, I'm waiting to see other panel members talk about it before I come in. So
okay, anyone open to it? I don't know if anyone's had that experience.
Well, let me just break the ice.
Okay.
Yeah, I think what is happening is that people inwardly are looking at their economic status. It's not really the government can issue that guideline, but people are looking at how much am I making if I, in first place, if I do that the way government wants me to do that, how much is going into my pocket? Government is not coming to, at the end of the day, give me the profit that I'm supposed to make that day if I serve 1,000 people. But if I follow guidelines and then turn these guys back, I'm going to make about £200, and I'm the one losing, not the government. So people are using their own discretion, to apply that, not minding the danger of transmission. They're not bothered about that. What the business is looking at this time is how can we maximize our profit the way we can at this point in time. So that is what is really putting that pressure on government. I've heard about a few supermarkets that said they will not police the covering of masks, the using of masks. They will not police it, because what they are looking at is how much can we make. If each person we turn back is a profit lost. So people turn
doesn't
back.
that defeat the whole purpose of face covering then?
Well, people are not buying into government's idea, because government is not going to pay them for turning people back. So if government wants that to work, they need to say, for each person that you turn back, we'll give you the profit you would have made from that. Then people.
What about the invitation for the government to invite people to go out and eat more? Isn't there an incentive? Is that not a big enough incentive?
If I'd like to comment now.
Okay.
It's quite interesting to see the other people argue one way or the other about wearing face masks when it comes to this. But one thing which is basic and fundamental, which you cannot take away, whether the government forces you to wear it or not to wear it, things are never going to be the same again. So if you have things happening and you decide not to do anything about it, nothing is going to happen. It's going to get worse and worse. When we started way back in March, the number of reported deaths, we know. And we compare that number in March to now, if we had done nothing, even though we did something, we were very, very slow to react. In places like Queensland in Australia, right from the onset, they engaged environmental health practitioners, and they were ready to be able to contain it. So talking it back to restaurants and pubs is all about being in a confined space. Like I said to you earlier on, if you have a pub that serves 50 people, and to maintain that social distancing, they now need to cut down to 25.
Right.
So without any rocket science, the profit margin is being halved.
Right.
So I think it's not a big sacrifice to make if that was going to save 2 or 3 lives. And going back to the government, I mean, everybody's aware of it now. Eat out to help out.
Yep.
Everybody goes out to eat on Monday, Tuesday, and Wednesdays. And that is why the government is encouraging people. I'm not speaking for the government. I'm not a government employee, so this got nothing to do with me, but I think it's an effort from their part. The Monday, Tuesday, Wednesday, people go out and they get 50% discount on what you
But
get.
people are going out to eat out to help the government, but at the same time, you're unable to consume food without not opening your mouth. And you also have the waiters that are walking up to you. I've seen waiters without a mask. Isn't that defeating the whole purpose?
One of the things which an added measure, I don't know whether people are aware of it, if you go to some restaurants now, they take your name and address. Not because they're trying to police you, it's to try to have your name and address. So God forbid, if anyone that attended that restaurant was to test positive, it's called track and trace. They can find out by knowing how many people were there. Okay, yes, we have 30 people. You better go and get yourself checked out because we have somebody that ate at that restaurant at 7 p.m. on a Tuesday night is tested positive. We know it's by contact, right? And by encouraging people to wear face masks, it's not to make their life difficult. We have instances where people have worn face masks and instances where people have not worn face masks. The people who decide in a community not to wear face masks, the death rate is astronomical. So the choice now, if they make it open, the government aren't going to sit about and fold their hands and not do anything about it. Because at the end of the day, we all know about this follow service that people are being paid to sit down at home, 80% of the salary. The government cannot sustain that. And there will come a time where they will have to increase the taxes. We hope it doesn't get to that. So come up now, there's not going to be anything. So I believe on the government side, Eat Out to Help Out is helping out. But if people feel that they're being compelled to wear face masks, it's only to save lives. This has never been done. And if you want to control it, we're going to have to do something which has never been done before so that we can save lives. Thank you.
All right. Before I bring another inference, I don't know if, Boy, do you have something to add to that?
Well,
The next one's possibly for you as well. But if you've got something to add, please.
Start a little point on that one. So I don't pretend to be a guru on this one, but I'm sure the government probably has some guidelines for the restaurants as well. So my assumption is perhaps they look at the number of people that are coming. They expect you to be from a bubble as well. I'm not quite sure whether that's been eased, but if that's the situation we have, then perhaps it's about policing those guidelines. And I want to quickly touch on what Larry said earlier on. I like the fact that you've put it across from a very, very legal perspective. I think this is the one disease that actually requires communal intervention. So we really have to support one another. So it's not about you being responsible for yourself anymore. This is where there's a bit of overlap, where you actually have a duty of care to other people before yourself, almost, in this situation. Just wanted to drop on those 2 points.
Can I just reply to that quickly? Now, we can't drive a coach and a horse through our legal structure system because of COVID. We have an established system in place. Those systems are there for your protection and my protection. We can't, because of COVID, drive a coach and a horse through them. Yeah. The rule of law must be proportionate. If you are saying, as a government, we are doing this to save life, the first question I would ask is, without scattering all the legal provisions, is there a less intrusive way of still getting what you want without destroying the legal structure? At the moment, Boris, with due respect to him, is destroying, when I say Boris, I mean the government, is destroying the legal system. Not only me, Lord Sumption, if you have time, go on Google, type in Lord Sumption, Sumption, one of the foremost eminent contemporary judges. He was elevated from the bar straight to the Supreme Court. Very intelligent man. He's with me on this point. We can't destroy the system because of COVID. It's all good saying, yes, well, people are dying. Oh, well and good. I understand that. I have friends that have died. But as a lawyer, we need to look for a way of balancing between the legal provisions, which is there for us, and at the same time, trying to find. And the only way you're going to get this out in the long run is to carry people along, not fining them £100 and a conviction. It is not going to work.
All right.
I just have a quick one there. I'm going to be very, very brief.
Right.
I'm just going to use a hypothetical scenario. Mr. A is a lawyer who is well and healthy. There's nothing wrong with him. And Mr. B is a guy who is tested positive to COVID-19. He needs legal help, and he's gone to Mr. A without wearing a face mask. He sat down, he's had contact with him. And unfortunately, Mr. A, because of social distancing, which has been thrown out of the window, contracts the disease, which without any underlying health duties, we know it could go either way. It could get worse or it could get better. We know of the Prime Minister initially when he started, oh no, I'm going to shake people's hands. There's nothing wrong with it. So people have a choice. If the government is trying to say what we need to know fundamental here is not about the law, it's about saving lives, right? If you do not save life now, there'll be nobody to govern. And that's where they're coming across. So people's lives are at risk. If we do not do anything in terms of making laws or making policies that is going to help in keeping it down, if these laws will be made willy-nilly without having to address an issue, then I will have a problem with it. But
all right.
things are happening now and we do not know how to handle it. So I'm just saying it's to help everybody. And if people feel they don't want to wear it, I'll just pray that they don't contact it. So this is where I stand on this.
All right.
So it's not written on your forehead. People
Right.
walk down the high street, you might have 100 people there, about 75% of them might be positive. You shake their hands, you cough, you don't wear your mask, it goes on to you, and that's it. It's not.
All right, John, let me pause here a little, just right there.